Hello, everyone, and welcome back to WiZR Voices, a podcast for learners and career builders. I'm your host, Malvika Isar, and today we are talking all about building a career in physical therapy and healthcare. And we are doing this with none other than Dr. Neha Shethia, a renowned physical therapy expert. Dr. Neha has a master's in physical therapy and has over 12 years of experience in specializing in neurology and geriatric population. She has also established her own outpatient clinic in Mumbai, where she's committed to providing personalized care, making sure her patients achieve comfort in mobility as well as overall well being. Through Dr. Neha's career trajectory, we'll explore the challenges and rewards of working in this dynamic field of physical therapy and understand the scope for young professionals like you who are starting out in this space in India. So let's dive straight into this conversation, Dr. Neha. Thank you so much for joining us today for this podcast.
Hi, Malvika, and thanks for having me over here. And it's really nice to address something about a field which is so close to my heart and which I've been pursuing for so many years. And I hope I'm helpful in giving a little light about this profession.
Absolutely. One place where we always begin, right, with this podcast is understanding educational background. What did you study and how did you realize that this is where you want to be?
So, frankly, I think I would put it that I just fell into the field. But most of us, and even today, it is you need to take science as your background, and you need to give your entrance exam, and based on the rankings you can choose which medical field you want to enter. I think physical therapy, most of the time, even today, if you see, people might end up, if there is little less rank, or they would not want to move away from the city where they are based, or it can be just as simple as monetary issues, because the fees do differ for different set of educations. So yeah, but it's a great field. It's a field where you get to interact, talk, communicate, meet a lot of people, and at the same time make sure that you make them pain free, make them move around. So I mean, it's a nice field to be in.
Right, right. And how does one start if one has to start off with their career?
So, if you have to start, like I told you, you need to give your medical entrance exam. Now, it's an
Right.
all India exam, NEET,
Right.
and based on the rankings, of course, you have your choices of college, and that's your bachelor's program, which you are entering, which is around 4.5 years, 4 years of study, and if I'm not mistaken, 6 months of internship. Post that, of course, physical therapy does offer varied specialization routes. As people are more aware about MBBS, but physical therapy also does have your specialization in cardiopulmonary, your neurology patients like stroke patients, those areas, sports, which is, very, very popular, sports therapist, or your general back, neck pain. So you have your musculoskeletal therapist. So these are the varied specializations which you can do once you have completed your bachelor's program.
Right. And where do you see physical therapy today in India, especially?
So I think the demand is growing, and it is going to grow. If we see the amount of sports which is being played in India, and the boom, and it's not just cricket, there are, right from your kabaddi leagues to other, pro kabaddi leagues and other leagues which are happening. So the demand for physical therapy is going to grow, because most of these teams, individual athletes, they would need physical therapy for all their different aches and injuries and rehab perspective. The other area where there is a need is your geriatric population or elderly population, because now the family group scenario has changed. You have more and more nuclear families or children who are not situated where their parents are. So the parents also want to stay healthier. They want to be active, so that whatever time, if they have to travel, they can travel actively with the kids, be with the kids, spend time with the kids. So this whole concept that we need to be fit, and instead of popping pills, or instead of just going under the knife, which is which
Yeah.
is the other healthier option. So therein the exercise comes in, and exercise science is a big part of physical therapy world. So that's why we have a big role to play now.
All right, that's really interesting, especially with sports becoming such a big part of physical therapy, and like you said, geriatric patients and everyone generally, the general awareness of physical fitness has grown so much. On a more human side, right? What do you think, and how do you perceive the work culture of physical therapists?
So, as far as physical therapy is concerned, your work culture can be divided primarily in which setting you're working. And by that, I mean it can be an outpatient setting where you have the patient coming in, getting treated and going out. The other is, of course, your hospital settings, the inpatient setting, what we call in our language. And usually, most of these places will have a hierarchy. So, if you are a new graduate, it's a great opportunity to learn from your seniors, learn the discipline. I think the school teaches us the theoretical knowledge, but the hands-on knowledge, how to deal, because every patient, even if the condition is same, is going to be the approach is going to be different. The way you interact with the patient, the way you explain the condition to the patient, that is going to differ. No two individuals are same, so your approach has to be different in that manner, and how you make that person feel comfortable. Um, the person might be scared, the person might be over anxious, or the person might be too rigid that they wouldn't want to do it, or might need is there a quick fix, doctor? So explaining to them and making them understand that a quick fix might just give relief in one of your symptoms, not the problem. So I think nowadays what I have come across, and as I've been practicing, counseling or explaining to the patient why. I mean, even if you've come to me and I know you've got a reference from the doctor, and the reason you are here because the other specialist has referred you for that you need to exercise or you need to get fit, but to make them understand why it is essential, and it is not just a matter of 15 days or month, but certain things are going to become part of your lifestyle. You know, so I think that's quite interesting, and convincing them. It's quite an
Absolutely.
interesting thing to do.
We were briefing for this
Yeah.
podcast, you told me about how you spend way more time, you invest a lot more time than a doctor would, right? And therefore, the relationship with your patients is also way different. Can you tell us more about that?
That is there. See, because when you are visiting any specialist, right? Even in the first visit, the maximum time they're going to go through the paperwork and will be 15 minutes, 20 minutes. But unlikely when you come to your physical therapy session, the therapist is bound to end up spending at least close to 45 minutes with you. So we do end up spending more time with the patient. Apart from that, you are going to, if in my clinic only, I might end up seeing the same patient, twice a week, thrice a week, for a period of 4 weeks, 6 weeks. So the interaction, what is the issue, the things which are happening, over a period of time, you get to know the individual apart, not just as a patient, but the individual also. And the interactions can vary in the terms if there is some other condition which is bothering the patient. We might be the first line of thing, okay, is there something else? Or is there a red flag, or is there, this is not related to my field, but in maybe related to, the patient might need a little bit of counseling, or the patient might need another consult from a specialist if there is any red flags or the symptoms which we think which might be hampering the patient's progress. So I think there we have a good role to play, simply because the amount of time which we end up spending, and the accessibility which the patient have to us.
Absolutely. Talking about accessibility, right? Where would you see, most potential for physical therapists to pursue their career in India? Are there more popular cities than others?
So, most of the metro cities, Bombay, of course, ranks very highly because you have access to better settings and, of course, in terms of learning opportunities as well. Same goes for other metro cities, Delhi, Chennai, I would say. Again, then Hyderabad and most of your two-tier cities. Like I'm telling you, there is that more awareness, and the people do want to stay fit. I mean, the classic cases that these n number of apps also which you have, everybody wanting to stay. अच्छा मैंने ये app पे देख के I've done this exercise or this exercise. So I think the role of the therapist then comes into play, guiding them. What is the exercises are not wrong, but what's correct for you as an individual. So the scope is really great. But yeah, of course, still a little bit more awareness as far as the patient population is concerned is more still in the metro cities, I would say.
Right.
Yeah.
And you mentioned about apps.
Yeah.
Since COVID, things have changed, dynamics have changed. People are working from home or remote. Is that a possibility in this profession?
So for physical, in fact, I also ended up doing remote sessions during COVID. More so, if the individual has more aches and pains or specific condition, I think a clinic visit is much better because the therapist can examine clinically what's going on. But if you are looking for just a general, like I mentioned, the elderly population, you're looking just for a fitness class and you have that once the brief about the individual. So those things can be done online because you already know the background about the individual, the aches and the pains, and it can be monitored. Or a basic strengthening or conditioning program. Of course, those things can be done online too.
Absolutely. And in the process, right, from a more, philosophical aspect, where do you see people falter in their career in this space?
I think everybody is in a big hurry to get somewhere. What I really feel, I am not saying that, if I see 100 patients today, all 100 of them I will be able to treat and they will be pain free. No, that's not going to happen. But staying true to your skill set and having that passion to keep on upgrading yourself, so you are giving the best to your patients. That is very helpful. The moment you start feeling that I think I know everything, or whatever is out there in the market, I know most of the thing, that's a wrong attitude, because every patient, no two individuals are same, so every patient always teaches you something. That willingness to learn and that willingness to keep on upgrading yourself should be there.
Absolutely.
Yeah. I think that's one of the important things.
Right. I remember you were also mentioning about empathy and looking at things from a more macro perspective.
Yeah. So again, that's what it boils down to, right?
Absolutely.
If you start thinking, okay, even if the patient, this is the complaint, but where is the problem originating from?
Yeah.
Right. So then you are behaving like a clinician. You are looking for the answers, and then you can guide your patient better.
Right.
I think that makes a whole lot of difference.
Right.
And that's what I mean. It's more about the passion and how you want to. Okay, what's the best I can do for the patient. So that's where it comes from.
Absolutely. A thorough root cause analysis, and also being aware of what the possibilities could be.
So being aware about the possibilities is only going to come if you're willing to learn.
Absolutely.
Right?
Yeah.
Because see, even if the healthcare, from the time I have graduated, there have been changes. Healthcare also relies, at least in physical therapy world, and that's true for most of the healthcare providers and other field as well, there is a more evidence-based approach. So by that we mean, even if I'm telling you, this particular thing works, there is a research behind it, why it is there, or a thought process which was there a decade or 2 decades earlier might not be relevant today.
Right.
So if I keep on functioning on that thought process, then I'm not delivering to my patient correctly.
Yeah.
So it is important to move forward and to know that you need to keep on updating yourself.
Absolutely. Neha, let's also talk about competition, right? The competition around you. How do you deal with that? And what keeps you inspired amidst all this?
Um, so see, competition is bound to be there, and like I told you, patient would want to go doctor shopping if they are not satisfied or the result is not coming at the pace what they want.
Yeah.
Having said that, the physical therapy world has also evolved a lot. There are a lot of different techniques, lot of different set of equipments. Now, in a smaller clinical setup, the kind which I have, a outpatient setup, it's not possible to have all sort of equipments as well. And here when I'm mentioning more of your pilates based rehab, which is
Yeah.
pilates based equipments which has become part of physical therapy world.
Right.
There are other equipments in terms of aquatic therapy or water based therapy, which has come into so having a pool or your water based treadmill, you need to have that much of area. So specific conditions or sports related thing, at times patient might end up going to other therapist.
Right.
But the way I see, or rather the way I have seen my role, is your therapist is becoming like your family physician.
Mhm.
So most of your aches and pains patient, until unless it's a highly specific condition, they would prefer their therapist to be within the walking distance or a easier access so that they can come to the clinic more frequently.
Yeah.
So also a therapist, unlike other doctors, like in a day I can end up seeing maximum 15 to 20 patients. I mean that's also max. Like it's mentally very taxing. The amount of time, as I mentioned earlier, behind every patient you will end up spending at least half an hour to 45 minutes. So it's not practically possible
Yeah.
to see everyone. So I
Yeah.
think competition is welcome as long as they're practicing the correct way.
Right.
um, a lot of time it is just ki, theek hai, we've done this machine and that machine and then the patient come to us.
Right.
Competition also doesn't mean that you should be able to advise the patient correctly.
Right.
Sometimes they might just come to you, okay, we have been referred, and you might feel the need, okay, this is not a person candidate for physical therapy, or might need another reference before you start seeing. So you should be
Right.
able to guide them as well.
So a very honest
You
understanding.
should, because see, even if at that time you're losing the patient, but the patient knows that you have guided them correctly, they're bound to come back to you,
Right.
because he or she knows that my doctor has made a correct suggestion.
Yeah.
So it's a relationship which you are establishing, right?
Right. Yeah.
So and I think it works, because if one person, one individual from that family has seen and is satisfied with the service, or as a therapist the way you have treated you, most of the time, at least I have ended up treating the entire family. So I would know family, right from the grandparents to the child. So
Right.
that's how it is.
Supremely inspiring. Which is why I would want to ask, for everyone who's going to watch this and
Yeah.
find so much inspiration, right, in this video, what would you tell them as a piece of advice? What should they take forward from this?
I think one of the best thing which I like about my field is a part. I mean, of course, every patient who's coming to the clinic is going to pay you, and you are earning, and that is there. But I think healthcare in general is the only field where you get a lot of blessings. Where, I mean, you have patients who are quite elderly, like somebody who's of my grandparents' age, and they'll come and say, "Ki beta, pain dur kar diya, main dil se aashirwad de rahi hu." So I think that's a big bonus. That's a very, very big bonus to us. Uh, Apart from that, I think when you start treating, and even people who are elder to you or senior to you, once you have treated them and you are able to show the result, the kind of respect
Yeah.
which you get, um, especially, I mean, when you've graduated and in those early years, and you feel, oh wow, like I did it. And there is a difference, and you start noticing that difference even in the way your relatives will talk. They'll come for your advice. So I think that's quite inspiring. Also, the field dynamics, it offers, because I'm a mother now, so I think physical therapy in general does offer me that opportunity to be a little flexible in terms of my timing.
Right.
In India, it is. I still think it's a little struggle, because if you have your own setup, I mean, you're never truly free. But so my although my bachelor's is based from India, I did my master's from US. So over there, early, I mean, and that's what most of my friends have done. You can do a per diem work. It's like, you pick and choose your hours, or you can go part time, or you can take a break and then again return to work. So those opportunities do make a difference. That flexibility, that you can have a little bit of family life and then go back to you, not losing your professional life at all.
Right.
That makes a great combination.
Right. You have autonomy on how you want to go about things.
Yes.
Right. Very cool. That was super insightful, Neha. What we'll do now is we'll move to the last segment, which is the lightning round. We have 3 questions, and to that you can give your answers in a phrase or in a word. My first question is one piece of advice to your younger self.
So I think I would say not to be too harsh. That is
Yeah.
what I would like to say.
Right.
And yeah, that's it.
Yeah. Okay. And one mistake that you feel people should avoid in this career.
I think we should all have a lot of patience. Too eager to get on the top.
Right. Right. So patience is key.
Yeah, patience is key.
Right. And one book or video or podcast that you would like to recommend everyone.
So I think the physical therapy books, if I recommend, they would be too boring. But one of the book which has been recommended is The Art of Explanation.
Yeah.
So it talks about the whole marketing and those other fields, but it's as valid as in the physical therapy world, because we are involved in, you have to communicate, you have to market, and you have to deal with the whole set of patient. So I think that's one book which I'll recommend.
Amazing. Thank you so much, Dr. Neha. This was supremely insightful. Thank you for taking out the time. And with that, we will wrap up this episode. We will be back with another episode super soon. Until then, stay curious and grow wiser every day. This podcast is a production of WiZR. I'm your host, Malvika Isar. Achyutanand Dwivedi is the head of audio and video production, and Shanika Jhunjhunwala is the executive producer. For more information on how you can grow your career with WiZR, visit WiZR.in. The link is in the show notes.
WiZR.